Joining us now is Dr. Scott Tiedebohl, thoracic surgeon at WellSpan Health. You're a thoracic surgeon, so tell us about the importance of lung cancer screening.
Well, thanks so much for having me. Lung cancer is a very deadly disease, as we know, and it's actually attributed to more deaths in America than any other cancer. In fact, more than prostate, breast, colorectal, and cervical combined. So it's very difficult because the average person gets diagnosed with lung cancer at stage 3 or 4 without screening. And there's limited options with those advanced stage cancers. Lung cancer screening, on the other hand, actually diagnoses people at stage 1 or 2 70% of the time.
Wow.
So that gives us a lot more options moving forward with what we can do to help treat and cure these patients.
So that proves just how important screening is for high-risk individuals. Who classifies as high-risk?
So high-risk individuals are patients from 50 to 80 years old that have a significant smoking history. And those patients that are either current smokers or had quit in the past 15, 20 years are eligible to get low-dose CT screenings, which can help identify objects earlier in the lungs to be looked into.
Of course, screening always evolves. There's always new technology. Probably by the next time you come on the show, you'll have something new to tell us about. How does WellSpan keep up with that ever-changing technology?
Yeah, very important. New technology is coming out all the time, and it helps for earlier detection. And that's the goal, so we have more options available to treat. So some of the options that we have available include robotic bronchoscopy. This machine can help get to smaller nodules, smaller spots in the lungs to help take biopsies to see what they are. Additional robotics to help with surgery so that they can have an easier recovery. Patients can have smaller incisions. They can undergo their surgeries and get out of the hospital back to life quicker. And sometimes putting these technologies together are really important.
You know, telling somebody they have lung cancer, clearly the worst part of your job, that's really scary. I mean, how do you deal with that, and how do you encourage patients?
You know, I think it's just nice to be there, that they know someone cares. So it's not about always winning, but it's always trying to comfort people, make them feel that they're important and that their goals and values are being listened to and heard. I think the technology is wonderful, but really what brings together cancer care are the specialists that coordinate the care and tailor it for each patient. And that's what I think people need to know, is that it's not a number, it's not a technology, it's not a machine that's going to fix you. It's a group of highly educated and skilled experts that come together to tailor a plan for you.
And well, combining that with the new technologies that you were talking about, how do you think that truly benefits patients and families?
It's a tremendous benefit, and you know, one of the things that we've been able to do recently is to have patients go to sleep with anesthesia and have this new robotic bronchoscopy find a lesion, target it and mark it, and while they're still asleep, have surgery to remove it. So it can be one anesthetic, one option. You don't have to wait for results, and it's not for everybody, but at times it can be very beneficial.
That sounds very beneficial, and just kind of just lighten the load just a little bit for patients. Thank you so much. Great to have you with us today. For more information, or if you would like to make an appointment with the WellSpan Health Cancer Institute, visit wellspan.org/cancer.